Good evening and welcome to the Medical Facts YouTube series, where we talk about various medical topics of interest. Feel free to leave your questions in the comments below and I'll try to answer them as best I can. Today we're going to talk about a condition that most patients and most doctors and most respiratory therapists really don't know much about, and that is vocal cord dysfunction. Many people have never even heard of the condition, and unless you've had it and been properly diagnosed, you probably don't know about it either. The vocal cords act almost like curtains in the back of the throat to regulate what goes in and out of your trachea. They obviously close so that you can cough, they close so that you can make noises or sing or talk, and they also act as part of your protection mechanism to prevent food and other items from winding up into your windpipe. Vocal cord dysfunction is when these cords close at inappropriate times, interfering with breathing. And while I'm thinking about it, if you found these videos helpful, be sure to put a like, to subscribe to the channel, and also to share on your social media so that other people can take advantage of this information. Vocal cord dysfunction is often misunderstood and is often mistaken for asthma because people with asthma sometimes make noises with their breathing and have wheezing and shortness of breath. Sometimes attacks come suddenly, sometimes they're severe and life-threatening. With vocal cord dysfunction, you can also have a sudden onset of attack, and you can make noises that sound like wheezing. And even listening with a stethoscope, a physician that is not aware of vocal cord dysfunction can mistake vocal cord dysfunction for asthma. You have to really be looking specifically for vocal cord dysfunction to be able to understand the difference between asthma and vocal cord dysfunction on the physical examination. To talk about asthma to start with, asthma is an inflammatory condition affecting the lower airways inside the chest. It almost always creates problems breathing out, and if you listen with the stethoscope, you hear what is known as polyphonic wheezing, meaning tones from multiple airways of various sizes playing at once, sort of like a symphony orchestra. With vocal cord dysfunction, the site of the obstruction is the larynx, right in here. And patients will often describe their symptoms as coming from the throat area. With asthma, the problem is almost always with breathing out. Sometimes in severe attacks, it may also affect breathing in, but it always affects breathing out primarily. With asthma, the problem is breathing out. You can take it in a deep breath, but when you go to breathe the air out, it takes a long time to get the air out and makes a wheezing sound that you can hear mostly in the chest. With vocal cord dysfunction, the problem is usually breathing in, but could be breathing in or breathing out. But most patients complain that it is a problem breathing in. They often describe the problem as originating in the throat, which is correct. They don't always have a cough and congestion, but sometimes they will cough trying to get the air to move. A patient with vocal cord dysfunction can describe that they were doing something when suddenly their breath just cut off. The first time someone has an attack of vocal cord dysfunction, usually it is in response to something irritating the vocal cords. This might be a cold or the flu or an episode of bronchitis or even pneumonia, something that causes that irritation and triggers the vocal cords inappropriately closing. If you're about to choke on food, you want your vocal cords to close. But if you're about to give a talk in front of an audience or making a YouTube video, and you don't really want your throat to close off at those times, so that's what makes it vocal cord dysfunction. Because the episodes are sudden, they often cause anxiety. And stress and anxiety will increase muscle tone on those vocal cords and make it harder for them to open. Because you can't see your vocal cords, your brain really doesn't know which buttons to push to cause them to open or close, except through secondary things such as talking or singing or coughing. We have found that if people have a video laryngoscope passed through their nose where they can watch their vocal cords on a TV screen, they can actually learn how to control their vocal cords. And that's sort of an advanced treatment that some speech therapists may be able to use in some centers that specialize in treatment of this condition. This never occurs when a patient is asleep. It does require the patient to be conscious when this happens. Acid reflux, splattering stomach acid on the vocal cords can trigger an attack. Sinus drainage can trigger an attack. Different smells, chemicals, other irritants, Clorox, cleaning solutions can trigger attacks. The attacks are self-limited, but they can be quite severe when they come on, and it is not unusual in a severe attack to see the patient's face turn colors and to actually see their oxygen saturations drop because of their inability to breathe. The challenge is if the patient relaxes, the vocal cords open back up. If a patient is sedated, the vocal cords open back up. But sometimes the presentation is so dramatic that the emergency room physicians see a patient in extremis who can't breathe. For all they know, there's a foreign body, and many patients have been intubated and placed on respirators because of this condition. Interestingly, though, at the time of intubation, they usually don't find any obstruction because the patient has been sedated and the vocal cords are wide open at the time of intubation. I've even met a few patients that had tracheostomies done emergently because they could not pass air because of this spasm of their larynx, also known as laryngospasm. Vocal cord dysfunction, while it can come on suddenly, can also go away suddenly. Once the patient is distracted to not think about their breathing, they tend to relax. I've had some patients tell me that if they were eating breakfast and had an attack, they would just start reading the ingredients of the Cheerios box in front of them, and that was all it took to get their vocal cords to open back up. Once a patient is educated about the condition and understands and believes the doctor, this is much less stressful and it's much easier to manage these attacks. Occasionally, patients become so anxious over vocal cord dysfunction that temporary treatment of their anxiety with medications such as sertraline, brand name of Zoloft, is sometimes helpful to calm down the underlying anxiety that leads to more and more of these attacks. My first approach in treatment is mainly patient education and teaching techniques to distract themselves from their breathing to allow these vocal cords to open back up. If that fails, we consider the anxiety medications and we make a speech therapy evaluation so that the patient can be taught breathing exercises to help control their respiratory status when they have vocal cord dysfunction. We sometimes get clues about vocal cord dysfunction from pulmonary function tests, which can show inappropriate vocal cord closures during the test because, of course, during the test, the patient is thinking about their breathing, and someone who has vocal cord dysfunction is more prone to have at least mini attacks during the actual testing, and we can see this in the pulmonary function laboratory. It is also a good idea to undergo a laryngoscopy to make sure that there is not some anatomical problem causing the vocal cords to have this problem, such as a paralyzed vocal cord, which sometimes happens in patients that have lung cancer or other injuries to the throat, or even tumors on the larynx sometimes can cause this sort of thing. But the vast majority of the cases are caused by external stimuli increasing the irritability of the vocal cords, causing them to close inappropriately. And at the time of laryngoscopy, you might notice twitchy vocal cords, but it's also possible to have vocal cord dysfunction and have a completely normal laryngoscopy. While vocal cord dysfunction is not purely caused by anxiety, it will certainly make someone anxious. And if they have underlying anxiety, the vocal cord dysfunction will make it worse. And if you have anxiety, the anxiety itself can make the vocal cord dysfunction worse. In summary, vocal cord dysfunction sometimes mimics asthma, but it also can coexist with asthma because people that have breathing problems from other causes will often have vocal cord dysfunction as part of their syndrome. When they have an attack of shortness of breath, inhalers probably aggravate vocal cord dysfunction most of the time, while they certainly help asthma. But the patients are reminded that vocal cord dysfunction is always a problem breathing in, sometimes breathing out, and asthma is always a problem breathing out and only rarely a problem breathing in. There are resources online. If you Google search VCD or vocal cord dysfunction, you can find a wealth of information on this condition. Thank you for watching this episode of Medical Facts concerning vocal cord dysfunction. Again, remember to like the video, share the video on your social media, and subscribe to the channel to see more content. Thank you very much.